All right, so here's the next 10 questions, 41 through 50. Question 41. Which structure is the red arrow pointing to? Ileum, A, ileum, B, cecum, C, colon, or D, jejunum? The answer is A, ileum. So this is an ileocolic intussusception. The ileum goes into the colon, so this would be the ascending colon and the ileum. This is fat. Many times you'll see lymph nodes within the bowel as well, or within the intussusception. Number 42. Patient developed a fever, leukocytosis, and a cystic structure after liver biopsy. What do you suspect given the history and symptoms? A, hepatoblastoma, B, hepatic abscess, C, hepatic cyst, or D, hemangioma? Given the fact that the patient had a liver biopsy, a hematoma would be a good differential diagnosis. But with symptoms like leukocytosis and fever, you suspect a B, hepatic abscess. Number 43. What is the most common malignant liver tumor in pediatrics? So malignant. A, hepatoblastoma, B, hemangioendothelioma, C, hepatocellular carcinoma, or D, hemangioma? So the answer is A, hepatoblastoma. The most common malignant liver tumor in adults is hepatocellular carcinoma. Number 44. What disease process gives this classic whirlpool sign? A, intussusception, B, appendicitis, C, midgut volvulus, or D, hernia? The answer is C, midgut volvulus. This is called the whirlpool sign. You have the SMA in the center and all these other mesenteric vessels wrapping around it, causing an obstruction, which is in a surgical emergency. 45. What is this echogenic lesion in a patient with tuberous sclerosis? A, renal cell carcinoma, B, angiomyolipoma, C, calculus, or D, hamartoma? So given the patient has a history of tuberous sclerosis, the answer is B, angiomyolipoma. Patients with tuberous sclerosis commonly develop angiomyolipomas in the kidneys. You can see other smaller echogenic lesions. The kidneys can be completely filled with angiomyolipomas. Number 46. The arrow is pointing to what structure? A, lateral ventricle, B, third ventricle, C, fourth ventricle, or D, septum pellucidum? All right, so this is either a temporal or transmastoid view showing the cerebellum, and you have this anechoic structure right here. That is the C, fourth ventricle. Fourth ventricle is usually anterior to the cerebellar vermis, or midline cerebellum, which is right here, fourth ventricle. Number 47. What would you expect when putting color Doppler on these testes? A, hyperemia, B, no color flow in the left testicle, C, twinkle artifact, or D, increased flow? So here's a transverse view of the scrotum. You got the right testicle, left testicle. Left testicle looks more enlarged, hypoechoic. There's a lot of inflammatory changes, scrotal edema, some fluid. This is most likely a testicular torsion. If you put color Doppler on there, you'll see no flow within the left testicle. So the answer is B, no color flow in left testicle. Number 48. This image was taken in an infant with scrotal enlargement. What are the findings? A, hydrocephalus, B, bilateral hydrocele, C, unilateral hydrocele, or D, testicular torsion? All right, so this is an infantile scrotal ultrasound. You have two testicles with large bilateral hydrocele. So the answer is B, bilateral hydrocele. Number 49. What are these two circular structures here, pointed by the arrow, posterior to this structure right here? A, renal veins, B, renal arteries, C, ureters, or D, cysts? The answer is B, renal arteries. So this is the inferior vena cava, or IVC. Typically behind the inferior vena cava, you're going to have one renal artery. In this patient, they have a duplicated renal arteries, as you can see here, going off the aorta. So this is a good way to see either the person has a single or duplicate renal artery. Some people even have 3. All right, number 50. What is the name of the structure the arrow is pointing to? A, chorial plexus. B, ventricle. C, caudothalamic groove. Or D, tentorium. The answer is C, caudothalamic groove. So here you got your thalamus, you got your caudate nucleus, and in between these two is the caudothalamic groove, and that is a common site for brain bleeds, the most common site for brain bleeds in premature infants. All right, stay tuned for the next 10 questions.